And just a reminder that we're wearing this face mask because of Mayor Lumumba's mandate to prevent the spread of the virus here in the capital city. Here at UMMC, they tell us they're maxed out. A spokesman says all ICU beds at the hospitals are filled.
We're full up.
Maxed out. A spokesman for the University of Mississippi Medical Center says all ICU beds at the hospital are now in use.
UMC critical care capacity is always pretty tight, but what we're seeing now is all the big hospitals and even some of the smaller surrounding hospitals have very limited bed capacity.
State Health Officer Dr. Thomas Dobbs says the recent surge in COVID-19 patients stressing out hospitals across the metro.
So it's a real challenge, and it wouldn't take a whole lot of COVID patients to overwhelm the system.
Definitely concerned about it, especially seeing all the spikes in the coronavirus cases. Usually in any metro city, ICU beds are something that are usually a hot commodity, and so COVID-19 has not done us any favors.
Dr. Michael Bookhardt is a hospitalist from Merritt Health Central. He says right now Merritt Health and its 6 area Jackson hospitals are fully staffed and they don't have a shortage of ICU beds.
I took care of several patients who were positive for COVID-19 just last week in both our COVID ICU and also our COVID isolation, what we refer to as the step-down floor, and we were never at risk of having 0 beds or anything like that.
Now, for the hospitals that are facing a shortage, Dr. Dobbs believes things could get a whole lot worse in the coming weeks. That's because some coronavirus patients can spend 7 to 14 days in the hospital before they may even need an ICU bed.